Yeah, so we had a study I'll be presenting with our abstract tomorrow on the use of ctDNA, circulating tumor DNA, in testicular cancer patients, where basically it's kind of a heterogeneous study, I would say, in the sense that there's not a standardized approach to collecting ctDNA in testicular cancer patients. If you look at the NCCN guidelines, I pulled it up again myself to see if there were any changes in regards to that, which I didn't anticipate, and ctDNA is not even anywhere to be found because it's not standard. So in our study, our institution, we looked at all of our providers that are seeing testicular cancer patients between 2020 and 2025 if they had any ctDNA collected. So some patients had just one value, some patients had 5 or more values. We included all those patients, and we looked at all stages. We looked at both non-seminoma and seminomas, which were about half and half in our study. We had about 41 patients and 153 ctDNA samples. So with this, we actually found that ctDNA was a more sensitive and specific marker, both in detecting recurrence and residual disease in all of our patients across the seminomas, non-seminomas, and all stages. Something important I want to note is 8 out of our 153 samples showed discordance, and by discordance I mean there was either a positive ctDNA result but negative imaging findings, or a positive CAT scan result but a negative ctDNA. So in all cases where this happened, so for example, in cases where the ctDNA was negative but the CAT scan was positive, surgery or a biopsy was done, depending on what the finding was, and pathology was negative in all cases to correlate with the negative ctDNA. And in all cases where the ctDNA was positive and imaging was negative, I looked at the cases where there was follow-up imaging, which is the follow-up in all the cases. Some of the patients actually hadn't had that follow-up imaging yet, so we couldn't see that result, but all the ones that did have follow-up imaging, the cancer declared itself and then was able to be seen on imaging. So I think this, we've seen some really promising results, albeit with a limited sample size, but we're seeing promise with the use of ctDNA in testicular cancer patients.